Hello, I'm John Seibert, and here is my research on sex chromosome aneuploidies and the risk of neuropsychiatric disorders in two population-based cohorts. So to give us an introduction on this, individuals with sex chromosome aneuploidies are characterized by a different number of X or Y chromosomes. And so instead of the typical 46, they could have 45 or 47. And so this is a underdiagnosed group. And so in the attached figure, the Klinefelter syndrome is the most common one that is shown. Individuals with sex chromosome aneuploidies are reported to be at increased risk for neuropsychiatric disorders, which we'll call NPDs, and this association is not well characterized. We leveraged two large population-based cohorts with linked genetic and health data to investigate the relationship between sex chromosome aneuploidies and NPDs. My code analyzes consenting patients' DNA and returns clinically actionable findings to them. The All of Us research program aims to make advances in tailoring medical care to the individual. Its mission is to accelerate health and medical breakthroughs, enabling individualized prevention, treatment, and care. To assess the frequency of relevant neuropsychiatric disorders, the International Classification of Diseases and the International Statistical Classification of Diseases, billing codes were extracted from linked EHRs. Age was then calculated based on the last encounter in the EHR, and tests of association were performed with logistic regression adjusted for age and sex. P-values were two-sided. Sex chromosome aneuploidies were called in my code using the protocol reported by Ogens et al. 2019. In this study, we included 4 chromosome aneuploidies, Klinefelter's, trisomy, XYY, and Turner. Among the most common NPDs in my code, they were anxiety and depression. And we found the same result in the All of Us cohort as described by the table below. The most rare diagnoses in my code are autism, motor disorders, and neurological. The All of Us, this differs by having cerebral palsy be in place of motor. Most common disorders were similar between the All of Us and my code cohorts. The rarest disorders were cerebral palsy and motor. In my code, sex chromosome aneuploidies increase the risk of NPDs between 5 to 10 times higher compared to individuals with a typical sex chromosome complement. So overall, the prevalence for NPD diagnoses were similar between my code and All of Us, and this is displayed through the proportion of cases. Individuals with sex chromosome aneuploidies were at an increased risk of NPDs.